viewers everywhere in the globe. Welcome to my channel, Dr. Bishay Medical Channel. And today's episode, we're going to talk about something extremely important, which is smoking and nicotine addiction. Please do not forget to subscribe to the channel so you get every new video, as well as please hit and smash the like button if you can. Smoking and nicotine addiction. There will be some slides that I'll show you. Tobacco is the leading cause of preventable death worldwide. Like when you stop smoking, you decrease death in the whole world. Every year, about 8 million or more deaths globally. And approximately 1.3 and maybe up to 1.7 billion people are currently smokers in the world. Smoking-related illnesses such as lung disease or heart disease or cancers account for billions of dollars spent in the healthcare system every year. It's amazing that they found more than 7,000 chemicals in the nicotine addiction can damage your arteries, your brain, your heart, your lungs, and certainly it has a lot of hazards of smoking. Nicotine is highly addictive. You start with one cigarette, you ended up with half a pack, then 2 packs a day, and more. So it's very difficult to stop smoking. The symptoms of nicotine addiction, how do you know that you're dependent on nicotine? You get craving. You really want the nicotine every day, the smoking. Increased tolerance. Initially you were smoking 2 cigarettes, now 10, now a whole pack, now 2 packs a day. You get withdrawal symptoms such as irritability and anxiety and difficult concentration when you stop smoking abruptly. You get dependent on smoking and you try to quit but you can't. And then you continue to smoke despite the fact you may need some money, you're not in the best shape of health, but you still continue to smoke. These are all red flags that you have addiction. What does smoking cause? The harmful effects including COPD on the lungs, emphysema, you get chronic bronchitis, you get unhealthy breathing, you get short of breath, you get wheezing, you end up going to the hospital, you cannot breathe, you need fresh air, you need the oxygen into your blood, and you can't get that because you have been smoking for 40 or 30 years. Certainly you can get lung cancer. All types of lung cancer relate to smoking. You can get coronary artery disease, coronary blockage, you can get a heart attack, you can get hypertension, you can get unhealthy heart. Definitely you get hypertension because the nicotine affects the endothelium lining of the blood vessels, and you tend to have unhealthy vessels. You get more blood pressure problems and more heart problems. On top of that, you get decreased immunity. Why you benefit from quitting smoking? You're gonna improve breathing. You're gonna improve your taste and smell. You're gonna improve your heart disease. You reduce the risk for heart attack, heart disease, hypertension. You decrease all kind of cancers. And we'll talk about that in a bit. And you increase life expectancy. On top of that, you save your money. What are the challenges of quitting smoking? Craving, that's the biggest one. You used to smoke, you cannot stop smoking. You get withdrawal symptoms. You tell yourself, I'm determined, I'm going to stop. You stop, and after that you get irritable, you get emotional, you get depressed, you get anxious. And then the nicotine is a habitual behavior. You used to nicotine, you used to smoke every day with certain people or at a workplace, and you kind of used to it. The peer pressure, maybe your friends at work or school, they enhance you to smoke, they help you to smoke, and they don't help you to quit smoking. And the availability, you have access to, you stop at any gas station, pick up your cigarettes. So these are all challenges if you're trying to quit smoking. The strategies, first we do counseling and behavioral therapy. We talk one-on-one about the danger of smoking. This episode could be a behavioral therapy for you. You kind of enlighten, you kind of know what's you're doing by continuing smoking. Nicotine replacement therapy. This is very important. You can give your patient nicotine gum, lozenge, inhalers, and patches. In the hospital, when somebody comes to me and very long smoking history, I put them on a nicotine patch. You could start 7 milligram or 14 or 21. And we use it every day and we make our way down. Nicotine gums, they sold by prescription. They're very good. Nicotine vape and electronic vape cigarettes are good. All of these modes and trials to help you stop smoking. Some medication, something called Chantix, talk to your doctor about it, 1 tablet a day, or Zyban can help you decrease the craving, decrease withdrawal symptoms. And there's a lot of websites and support lines that can help you stop smoking. This is the cycle. Nicotine addiction, you start smoking, your brain releases neurotransmitter, your blood is full of nicotine, your brain craves nicotine, and your emotion, you want the nicotine back, and you start a cycle that you can't get rid of. This is when you smoke, the brain is stimulated, the brain start triggering and hormones that is not good for the body, and you start being into a cycle, and your brain gets addicted to the nicotine, and you have some chemicals and neurotransmitters gets affected by chronic nicotine addiction. This is the symptom when you try to withdraw symptom from nicotine. You stop nicotine abruptly, and you used to smoke for 30 or 40 years a lot. You can get nicotine craving, depression and anxiety, irritability, difficult to concentrate, difficult to do any task. And some people may get enhanced appetite and gain weight. Some people lose appetite. On the other hand, a lot of people get heart disease, nausea, diarrhea, sweating, lots of problems from smoking. This is the type of cancer you can get: head and neck cancer, throat cancer, lips cancer, tongue cancer. You definitely get lung cancer. Some people get leukemia. Some people, big one, bladder cancer. Some other people less likely to get colon cancer, stomach cancer, or pancreatic cancer. On top of that, you can get aortic rupture. You can get problems with hypertension, problems with endothelium of the lining of the blood vessels, problem with elevated blood pressure because the vessels are not healthy. You can get COPD, you can get chronic bronchitis, you can get even decreased fertility, and some people may get down the road some bone fragility and osteoporosis. This is the nicotine replacement therapy. Please try to smash your cigarette, and instead try to talk to your doctor about nicotine patch, nicotine inhaler, counseling, nicotine gum, some medications such as Zyban or Chantix. This is again a slide that shows you all the different modalities, including patch, gum, lozenge, mouse strips, electronic vape, and nicotine patches. This shows you how to put the patch. This is the healthy lung, full of healthy bronchi and bronchioles. This is a very bad lung from chronic smoking, almost black lung. That's your lung, dear viewer, when you've been smoking 20 or 30 or 40 years. It's kind of black. It's not functioning well. It's not doing its job. It's not doing the oxygen, carbon dioxide exchanges, and that's what you get. This is again a healthy lung. You can see the blood vessels are very healthy, the bronchi and bronchioles. This is a smoking lung, which is almost black, and it's got unhealthy bronchi, bronchioles, rupture of bronchioles, COPD. The lung gets distended, inflated, and not doing its job properly. This is again a healthy lung. You can see on the chest x-ray. This lung is not healthy anymore. There's some start of cancers from the nicotine addiction, and certainly this lung is not healthy at all. With that, I come to the end of the episode. Thank you so much for your time and attention. I really appreciate your time. Please watch these channels. There's a lot of good videos. This channel will educate you a lot and bring you questions to bring it to your family doctor. With my greatest wishes for all of you guys, viewers, to get the best health on earth and live long and live healthy. Thank you.